Error. Electricity in line. Override accepted. Infusion initiated.
Welcome to the INS Infusion Room, the official podcast of the Infusion Nurses Society. In this podcast, we explore all things infusion therapy through a real-life conversation, covering the latest trends, new research, evolving standards, and key industry insights. Whether you're an experienced infusion nurse or new to the field, we aim to keep you informed and empowered with the knowledge to stay at the forefront of the profession. My name's Derek, and I'm your host. Let's dive in. Thank you for joining us for another episode on the INS Infusion Room. Today we have expert guest Autumn, and we'll be discussing technology advancements within home infusion and what it means for care delivery. Welcome, Autumn. Would you mind to introduce yourself and provide a little bit of your experience?
You bet. Thank you so much, Derek. Thanks for having me. My name is Autumn Romanowski, and I am an infusion nurse. I have been in the nursing field for 18 years now, with all of that time spent in infusion. I started out in the oncology space and then moved into the home infusion, ambulatory infusion suites a little later in my career. And just really excited to join you today and talk a little bit more about the technology and how that applies to the infusion specialty.
You know, you were referred by someone I work very closely with, but a little birdie on the street told me you had some amazing programming within your home infusion realm and that you were utilizing smart pump technology and telehealth. And, you know, some recent reports I've read that home infusion is moving more into the direction of implementing additional technologies. So I want to bring you on, talk to you more, and pick your brain as to your successes and wins and maybe what you predict for the future.
That sounds great.
So let's start out with smart pump technology. So if you don't mind, maybe some of the listeners that are unfamiliar with smart pumps, what can they do? And what does it mean for practice, and maybe how you use them in your current organization?
Absolutely. Happy to help with that. So when I think about the difference between pumps and smart pumps, I like to kind of relate that to the difference between a phone and a smartphone, right? So you think about, the intent of a pump is to deliver that medication, from the reservoir into the patient at the correct rate. But smart pumps have some added features that regular pumps just don't have integrated into them. So these pumps really allow for the ability to tailor those infusion parameters to an individual patient. They work off of libraries oftentimes where they have a library of therapies programmed in. So for those step-by-step parameters that we have programmed in for the specific patient and the specific therapy that they are receiving. So it really helps bring an extra layer of safety to the use of these pumps with those libraries that are available. And then smart pump technology also allows for the ability to have a wireless connectivity available and real-time monitoring for a patient and their infusion. So it really enables you to look and see their adherence to therapy, if they're infusing at the correct rate on the correct schedule. And if a patient was having any issues with their infusion or questions about their pump, you have the capability to basically log on and look at that real time, which is a difference from the traditional infusion pumps that we are all used to.
So you would have the capability to monitor an infusion remotely.
Yeah, which is really what an amazing concept, right? Like if you think of, a lot of therapies, that we provide, the nurse is present for those therapies and they are monitoring that pump real time. That's not where we would be using smart pump technology. This is more for your patient who is independently administering that therapy that we've taught them to that level of independence, but that just provides that extra layer of safety, security, helping to monitor how they're using that infusion device, which is something we did not have in the technology realm previously.
Yeah. When I started into the profession, I was still doing infusions via gravity and doing drop factors and
absolutely. Yeah, things have come a long way.
And that still exists in some areas, organizations, and parts of the world, not to discredit that, but we've come a long way. And
Really
now
have.
we're moving into the home space and really elaborating on what services we can offer in the home space for these patients. It's amazing to see the technology catch up and be able to allow our patients to be more autonomous.
Absolutely. And you really nailed it with that autonomous component. That's really our goal when we're teaching a patient to infuse their therapy independently. They always have that layer of support, right? Their clinicians available 24/7 for them to answer any questions, but that just adds an extra layer of support for them and just that extra layer of safety, which is really important. And especially as we see more therapies move out of that hospital setting and into either the home or that infusion suite space.
Now, your organization is pretty large, correct?
We are, yes. We're a very large infusion provider, and we are present in most states in the country. So we have the ability to provide care for patients really across a very large geographical area, which is really a blessing to be able to do for patients because these needs are not unique to certain areas.
Absolutely. And I can imagine the struggles with the different type of areas, urban versus rural versus the state practice acts and so on and so forth. So I can imagine that we talked a little bit about the telehealth aspect, but I can see that being very impactful. But how do you currently utilize telehealth and what is that like in your nursing program?
Yeah, that's a great question. So telehealth is really an exciting addition to the healthcare world in general, right? Like historically, we didn't have the ability to do that. And really
Bridging those gaps.
it really is the bridging an amazing gap. And this really became more available during the pandemic. It really became as a healthcare entity, not just our organization, but, in the healthcare world at large, we really had to pivot quickly and try to determine ways to assess patients without being able to be present with them face to face, in person. And so that's where you will hear a lot of people refer to them as virtual visits, which is, really kind of like we're doing here today, right? We're having a conversation, but we're not in the same room together. And telehealth is the same way. So really being able to utilize that platform to further assess patients. If a good example of a perfect use for this is a patient's calling after hours and they have a question and it's normally that would be an on-call question. You're trying to troubleshoot over the phone if they're maybe having some difficulty with administering an infusion, or if they have a question about their infusion device or their venous access device and they really need an additional set of eyes to look at that. You can use this platform to have that assessment opportunity without having to send someone geographically to that space. So there are some things you can actually navigate without even having to have a nurse present in that space. Like a perfect example I love to think of as a patient that had learned a new administration method. And she'd been taught in person and did the return demonstration, but then she called and said, gosh, I forgot some of the pieces. And a little hiccup to this. She said, I've traveled out of town. I'm still in the same state, but I'm out in kind of the woods. She's like, I'm getting ready to go camping and I have everything I need, to keep things clean and safe. She said, but I can't remember exactly. Is there any way you can show me? And it was like, this timing couldn't be better. We actually have the capability to do a telehealth visit. So it was really fun because we were able to do a telehealth visit. I was able to grab the supplies and show her what that looked like. She was able to mirror what I was doing with the supplies she had. And she gave such fantastic feedback at the end of it, where she said, I have to say that was actually, number one, it was a lot of fun. She said it was really fun to be able to do that. And my stress level has decreased significantly because she said I was picturing that I was going to need to drive all the way back, to come into the office, or, I wasn't going to ask you to send a nurse out to, literally she was out in the woods getting ready to go camping. So it was a really good example of the use. She still had great connectivity. That's a big piece of the puzzle. You have to have good connectivity, of course, to be able to have those conversations. But it really can be a fantastic tool to help us provide care to patients in unique situations, and just certain situations where, we may not need a nurse to be there right now, but let's determine if we do need to have that happen. So you might find during that assessment, actually, we do need to send a nurse out to do some hands-on intervention, we're on the way. But that helps us really field those and determine, who we need to dispatch to and when. And it's really just such a fantastic tool that's available to us now. So we've had really good success.
Now, is this an app on the phone that your patients get, or a link, or how does that work?
So it's a link that they receive. Yeah. So it's integrated into our current platform, and it's a link that they receive that enables them to have that communication back and forth through that HIPAA protected platform, so that they can have this type of visit that's virtual. And if you think of any time, a lot of us have experienced this type of visit with our primary care provider, where that's an option, and they may text you a link. So it looks a little bit different depending on the platform that you use and what you have set up. But the functionality of it is pretty similar across the board. I will say something else that's important to, some of the fear that was around telehealth or virtual visits, both from the clinician side providing that and the patients receiving it, was their ability to navigate the technology, because it can be a little bit intimidating. But we've really found that if you can navigate a smartphone, you can do this technology. And even people that don't have that familiarity, just taking that extra time with them to provide that guidance is really helpful. It also helps us identify patients where that's not the best choice for them, right? Like they really are, it's not going to be the safest way for them to receive that care. And that's okay. That helps us tailor their care and make sure that we have nurses available to see them in person. So
I can remember working as a mobile vascular access nurse, and you're mobile, so you're going from place to place, and
right.
we would be dispatched, and we would go and see the patient. Maybe it was a troubleshoot. So it would be reported that the patient or nurse or caregiver was having a difficult time either flushing, or they would report that it was occluded. I would come, and immediately I would see that the clamp was on.
Yes.
So a simple fix that could have been prevented, and really helped with the cost savings within healthcare, because now I had the mileage associated with traveling.
Mm-hmm.
I had my time. I had, now we're billing the organization for a visit, when really this could have been prevented with things like telehealth, or having those additional tools to help make things more efficient. Plus, the patient had to wait, so that was a delay in care too until I could get there, right?
Absolutely.
So I think you bring a very, very valid point, and it definitely has its place in this space. I can even give another example. My aunt was helping my uncle at home with his home infusion with antibiotics recently. And she would call, and I would walk her through how to do the infusions. And, it's a scary thing when you're not used to. I think that we can take that for granted as healthcare workers, that we see things like it's very easy to us because it's something that we're accustomed to, and we're very knowledgeable about. We're experts within our fields. However, for these patients, it's a completely new experience, and sometimes we just need that extra confidence or the walkthrough. So it's so likely to hear that you have those additional resources, organization, that you're really applying those technologies to move the needle on care.
Absolutely. And I love that you brought up the clamp, because, right, how many times do we find that was actually the cause? And even when you're troubleshooting over the phone, if you discuss those components, but being able to see them just adds such an extra layer of being able to provide that care. And I can think of several situations where just the use of that telehealth platform, we were able to resolve what the issue was very quickly, provide that guidance, solve that issue. And the patient was able to get their dose administered faster. We were able to really be good stewards of all of our resources that we have and allocate them appropriately. And then also determine when we need to go see someone in person. So it really is a fantastic platform.
I even venture to think about the future, it may be reality for some organizations or some practitioners, but integrating those technologies, what does that mean? So if we had telehealth and we have smart pumps, could that mean that an infusion nurse could be remote, helping a patient with the infusion? And what does that mean for the care? So many questions come to mind when I consider what the future looks like. Have you thought about anything like that?
Absolutely. It really enables us to kind of, quote unquote, think outside the box. I just think about where things started, from the beginning of my career just until now, and the additional patients we've been able to care for with these advancements. And I just think of that even beyond that, what does that look like? How many more patients could we bring care to in an alternate setting outside of the hospital with these technologies? And there's going to be things that fit really well in this space. And then there will be things that we identify, no, we still need to utilize those extra resources for these people, but it just enabled us to bring that care to more people. And really, when I think about really what gets me so excited about our specialty in general, and I love talking about our specialty, really to anyone that'll listen, whether it be a new nurse coming into the field and, just starting in their career, or someone I might overhear in line at the grocery store. It's the quality of life that infusion therapy brings to patients. It's really what's just really gets me so excited about what we do. And I can think of so many patients, their quality of life has been improved with the therapies that are able to be provided in these settings, that I could take up a whole other podcast for you, Derek, of just talking about stories upon stories upon stories, and inspirations and things I've seen when you bring that quality of life piece, where the only thing keeping a patient in the hospital was their need to receive this infusion. And the fact that they have other options available to them and they can receive these infusions, whether they're at home or whether they're coming into an infusion suite at a regular interval, it's much easier to navigate that way. Patients that are traveling, going on vacation, camping, going on their honeymoon. Like, I can think of so many where we've seen that impact. And when you think about the use of technology, it just makes it even bigger. Like, you can bring these services to so many more people, and use that technology to really help us leverage the resources that we have available in the healthcare system, and really be mindful. And again, like I said, have that impact in the quality of life, it's just significant, and it's been amazing to watch.
Absolutely. As we advance with technology, I think many professions are nervous. They're nervous for one, the change, but also nervous about maybe moving to a place where they lose their job. And that's some feedback I get. The nurse cannot be replaced. By the way, I truly believe that. And I think that when we're looking at these technologies, it's always going to have to be in conjunction with the skilled clinician, with the professional that guides those tools. Have you heard any gossip or any fears about that yourself?
Yeah. And actually, I'm glad you brought that up, because, it is one of those things that come to mind just in general in life when you hear about the use of technology, or, robots for things or things like that. That's usually one of the first things people think of. But the clinician is a pivotal piece of the use of this technology. That piece can't go away, right? You need that person to teach people how to use this technology, to help interpret the results, to coordinate all of those pieces together. So actually, what I found to be beneficial when I'm thinking about when the use of just the talk of virtual visits started, like, we're going to do this virtually. You can imagine that brought a lot of questions, right? What do you mean virtually? And a lot of uncertainty, some fears about, is that going to be, is sufficient a way to provide care? Am I going to know how to use that technology really comfortable in front of a patient? But I might not be as savvy with this smartphone. How can I learn that? So really making sure that we provide that step-by-step guidance for people to make sure that they have specific instructions for how to do everything, and make sure that they have support so that if they do have questions, they know who to call and they can reach out. And so that's where that clinician is still such an important component of that. And really troubleshooting. I've found that identifying super users is really helpful. So if you have people that are really comfortable in that space, they're really good at teaching it, good at using it, they're excited about it. Those are really helpful resources to not only get the clinicians excited and on board and help them see how it can be an additional tool, but also the patients as well. And, I think about the different advancements that have happened, throughout healthcare. And the fear that came with each one of those advancements, right? There was always those questions of, what does this mean for the future? A really fun example I love to share is a patient I met years ago. And she was in her 90s, and we were doing an infusion for her, and she was a nurse. And she said, I'm having such a good time watching all of your equipment. because when I was a nurse, we didn't have all these amazing tools. She said we didn't have a catheter that was for, one patient. We had to actually sharpen our needles and clave and, use the autoclave and like reuse them. And it was just, we had such a really nice visit just talking about the changes that have happened. But she actually spoke about the fear that came with that. She said, we just couldn't picture like, how would we be needed as nurses if they have all these amazing things to make things easier? But she said, wow, I see that we do. And look at all the amazing things we can do. So it was really one of my favorite visits with a patient, because what a treat to be able to speak to a nurse who has seen so many changes over her career.
100%.
Yeah.
You mentioned robotics, and I actually read an article a few weeks ago about robotics moving into the home infusion space. I don't know what that looks like, and honestly, I can't really speak to it other than what goes through my mind when I think about robotics and home infusion.
Yeah.
But wow, we're tapping into that AI robotic realm, and
Yeah.
we're in a transitionary period. And like you said, with any change, we feel uncomfortable and we adapt, and we continue to improve the care with those adaptations.
Absolutely. Absolutely. And I think my first thought you said robotics was, what does that look like? So
Yeah,
who
this
knows what?
particular article is referring more to robotics used for compounding, monitoring during the infusion. So it's taking the technology from the smart pumps, but then integrating some AI and robotics into it as well. So taking it to that next level.
Yeah. Hey,
Interesting.
just exciting.
Very sci-fi as of right now, but who knows, 10 years from now, that could be the norm.
Yeah. When I think of that, I think what an exciting time to be a nurse. What an exciting time to work in the infusion space. There are so many treatments that are administered, via infusion, and the list continues to grow, and it will continue to do so. So I just think it's such an exciting time to be part of the specialty and, just have the opportunity to be on the forefront of integrating those changes and not only helping the clinicians see where they play a role there and how it enables us to bring care to so many more people. And then helping the patients see that, this is something they can do, which I liken it to all the times I've taught patients how to administer their therapy. You go from that moment of really just sheer anxiety and panic about finding out that they have to administer something, on their own without a nurse right there next to them the entire time, watching as they learn and they become independent and they're confident and again, that links back to that quality of life, really empowering people to do the things that they're able to do, but also make sure they know they're supported throughout that journey. That's really one of the most amazing things about being a nurse, and especially a nurse in this specialty.
I totally agree with you. I think that's a wonderful place to mark this. So I think that's a wonderful cap to our discussion. And, Autumn, I really want to thank you for joining me today. Do you have any final thoughts before we end today's program?
Oh, yes. Thank you for the opportunity. I really appreciate the time to speak with you today. Just final thoughts, the things that come to mind for me just in the day to day. But again, as we were speaking here, is just reiterating what an extraordinary opportunity we have to bring increased quality of life to our patients and those that we serve. And just, any opportunity that we have to be a part of something new, whether it be a new technology, a new platform. Don't be afraid to learn a little bit more about things. Don't be afraid to ask questions and see how things can integrate, bring ideas to the table. Hey, can we do this? Even if we can't do something the way it's outlined, maybe we can find a way to make that work. It really does make a difference. And that's how change happens. And that's how growth happens. And that's how we're able to bring care to even more people and really impact the quality of life of those that we really have the honor to care for. So I just want to thank you again for the opportunity to join you and share a little bit about my journey and the experiences that I've had and the things I'm looking forward to.
Well, thank you so much. And thank you all for tuning in today. Today, we discussed technology advancements at home infusion. And our expert guest, Autumn, has provided us with valuable insights. I'm your host, Derek Fox, and it's been a pleasure sharing this important discussion with you. Remember, knowledge empowers us to make informed decisions. Until next time, stay informed, stay curious, and keep gaining knowledge. Thank you for tuning in.
Infusion complete.